My name is Heun, I'm a consultant psychiatrist, and I want to continue our series, Mental Health Disorders Explained. Hello, and today I would like to talk about generalized anxiety disorder. It's a quite common disorder, which is more or less characterized by excessive worry, free-floating anxiety, feeling of apprehension in everyday tasks and problems, with lots of psychic and muscle tension, which causes significant distress and impairment. The symptoms are at least 6 months, some people say 2 years, of excessive anxiety and worry with tension, apprehension about everyday events. That could be at work, could be at school, could be within the family. It should be included, could be with restlessness or feeling on edge, easy fatigability, concentration is poor and the feeling of the mind is going blank, pure concentration, irritability, muscle tensions, and sleep disturbance. So lots of anxiety. ICD-10 focuses on palpitations, tachycardia, sweating, trembling, shaking, and the dry mouth. So these are autonomic symptoms from the autonomous nervous system. Other physical symptoms are breathing difficulties, choking sensation, chest pain, discomfort, nausea, and physical abdominal distress. There's this feeling of dizziness, unsteadiness, people feel fainting easy, they feel chest pain, discomfort, nausea, and abdominal distress. There is this feeling of being unsteady, faint, lightheaded. Some people report some derealization and depersonalization, which indicates that they don't feel things are normal and they sometimes feel like being in a film. And some people feel of going crazy. Lack of control is something which is very common. Hot flushes, cold chills, numbness, and tingling of the fingers and hands, which sometimes can be related to hyperventilation. Restlessness is a problem, inability to relax, feeling on edge, then being very anxious and being very upset about minor surprises, easily being startled, and there is this concentration difficulty. And lots of anxiety, worry, and the odd thing is that people very often worry about the anxiety, so they're anxious about being anxious. And there's irritability and difficulty getting to sleep. Usually there is some comorbidity, or very often, at least when people come to the hospital or to the psychiatrist, then depression and panic attacks might be relevant comorbidities. The prevalence is about 3 to 6% in different studies. They vary a bit. Some studies say 3, some say 6. Usually the highest comorbidity or the highest highest prevalence is in the age of 45 to 59. There's sometimes association, especially in early onset cases, with childhood fear or marital disturbances or upset. Later onset is very often about stressful life events, and people who are single and unemployed are more often suffering these problems. The etiology is a little bit difficult to generalize. It's sometimes say it's genetic, so you have more family members who also have depression or generalized anxiety disorder or other types of anxiety disorders. Neurobiological studies have shown some disturbances in corticotropin releasing factors and behavior inhibition. There might be some speculation about the disturbance about the HPA axis. However, that's something which is not really relevant for the treatment. In the psychology area, they have speculated about diminished senses of control due to traumata, problems with attachment to initial caregivers or overprotective parenting, but that's very, very difficult, and I think these studies are difficult to generalize. It's very, very difficult to find causes for the individual, and sometimes it's better to focus on the treatment than on the etiology or the cause, or finding some individual case which might be a trigger. If you know the trigger, sometimes it doesn't make any difference, because sometimes you can't change a trigger. Let's say if you had difficult childhood, there's nothing you can do about this childhood later. You can understand it, you can try to make sense out of it, but usually that doesn't affect the generalized anxiety disorder. As I said before, there are lots of comorbidity with other anxieties, phobias, social phobias, panic disorder, depression, and as a consequence of the anxiety, sometimes drug problems can be caused. On the other hand, withdrawal and drug problems and alcohol abuse can also cause the generalized anxiety disorder. So this is my first overview about generalized anxiety disorder. Hope we can continue this, and if you're interested, then please subscribe to our channel, Global Psychiatry Archives, and enjoy the day. We will update the treatment options soon. Okay, bye-bye, and thank you for your attention. Bye-bye.